afternoon and thanks for joining us. I'm Judy Simpson. In recent years, cancer survivorship rates have been on the rise. The trend is the result of several factors, including groundbreaking research which has led to new or improved treatments. The rise in survivorship is also due to education. We now know that factors such as proper nutrition, weight, and exercise play an important role during cancer treatment and recovery. And those factors are being emphasized by the Vermont Cancer Center and its partners in a program specifically for cancer survivors. It's called the Ultimate Survivor Boot Camp. And to find out more, I'm joined by the Cancer Center's Dr. Kim Dittis and by the founder of Pink Ribbon Cooking, Chef Curtis Hem. Welcome to both of you.
Thank you.
Now, you've both been on the program before, but for viewers who don't know, maybe you could give us a little bit about your background. Curtis, why don't you start?
Sure. I used to be the dean at New England Culinary Institute, and I left there and I started a program called Pink Ribbon Cooking. And it's a website and it's a resource for cancer patients that are in survivorship, looking for prevention even. And it's really about the whole family, teaching them how to cook real food.
Mm-hmm. And there's a very personal story behind that.
Yeah, so my wife is now a 10-year cancer survivor, which is nice to say.
Mm-hmm. And so how about for you, Kim?
I'm a medical oncologist at the University of Vermont in Fletcher Allen, and I treat primarily breast cancer. And I'm also the medical director of our oncology rehabilitation program. It's one of the few onc rehab programs in the United States. And my background is in nutrition, and my research area has to do with a lifestyle change for cancer survivors.
And it's called Steps to Wellness, and it's a medically based rehab program. Tell me a little bit about why this is such an important program for cancer survivors.
So cancer therapy is really tough to take, and there's a lot of collateral damage associated with cancer therapy. I mean, the therapy is the reason why we have so many cancer survivors, but I think it's important to also then focus on getting back into as good a shape as one can possibly be. And we know that cancer survivors tend to not exercise as much as the general population, and at least for some cancer populations, excess weight is a problem too.
Mm-hmm. And so this program actually has medical staff on site.
The onc rehab program does, yeah. There are physical therapists, exercise physiologists, and some physicians and mid-level providers as well.
Mm-hmm. Okay, as I mentioned, you're teaming up now for a new program that's called the Ultimate Survivor Boot Camp. What is that, Curtis?
Well, we came up with the concept. I think it was a conversation between Kim and myself, and just really, we wanted to do something that was experiential. And we wanted to do something that introduced cancer survivors and even beyond how to do proper things with guidance from experts, and I think that's a really key point. But the experience part is what I take and I really hone in on is if you get in a kitchen with somebody who really is comfortable in educating somebody, you can inform them so much about how to do something efficiently and effectively that they can make a lifestyle change more easily. And it's the same with the exercise, it's the same with the weight management piece. When you're introduced to the right pieces of information, it's presented properly in multiple modalities, if you will, it becomes something that can really inform your practice and you can make a successful change.
I can give you an example. I mean, you could say, here's a recipe, but you take it even steps further saying, this is the meat that you should buy, this is why, this is how to slice it, this is how to make the recipe, and you find out how easy it is, and you're like, wow, that's great.
Right, and for a chef, it's easy because we're trained in certain things. So if you were to buy the wrong cut of meat, for instance, in a chicken dish, like we were talking about earlier, mm-hmm. And you were to slice it the wrong way, it becomes really tough, and it wouldn't be enjoyable.
Right.
Or if you buy the wrong ingredient, then and what we do is we really work with the people and we walk through recipe after recipe, and they're chosen specifically for something that is impacting. That they can make that change and try it at home.
And so, Kim, how about for you?
So I think an important component of lifestyle, of course, is the food and the exercise and focusing on weight maintenance. And this particular program involves Jean Harvey, also, who is our expert at the University of Vermont on behavioral-based weight loss interventions. She's the person who developed VTRIM. And the three of us have teamed up to provide information in various aspects of lifestyle change. So she focuses on weight management and food selections, and I emphasize the exercise aspect. And I know that individuals after cancer therapy are sometimes a little hesitant to sort of jump into an exercise intervention and aren't sure how much they should push themselves, what they should do, and we help provide that information.
So why a boot camp?
So we had talked about doing something a little bit more laid back at one point, but This sort of hit me around the New Year's, because that's when everybody's making their New Year's resolutions. It's like, why don't we do something that's just a little bit more aggressive, you know, sort of jump in and really focus on all of these different aspects and jumpstart individuals towards making healthy lifestyle changes to help them sort of figure out, okay, I can do this, just as we had mentioned, and push them forward a little bit.
Mm-hmm. It's interesting, too, that you say that, because I would imagine that someone who's gone through cancer treatments, probably weak, not feeling great, probably feeling like, I just can't do that. But it's really important to turn that around.
Right. Or just not knowing what to do or where to start as well.
And how about for you, Curtis, as far as the boot camp
Well,
philosophy?
boot camps, it's natural. So, I mean, most of my time as an educator is spent in a hands-on environment. So being able to teach somebody side by side, you could do a demonstration, and that's great. It's a very effective means of communicating. You could do stuff online like we do. But to be in the room with somebody and to be able to say, okay, this is how you chop, or this is how you slice properly, that you can't replace that. And I mean, you can do it, but it's not as impacting as that. Also, boot camps are incredibly popular for foodies. So if you're into food, boot camps they're out there. And these are, 4-day retreats, and, they go anywhere from, a basic, at a summer camp to a full-blown, institution of education. But boot camps are really popular.
And you find that combining the two, the exercise and the nutrition part of it, and cooking, or the 3 aspects actually, is effective?
Yeah, I think it's really important, because those are the keys that you need to carry forward into making lifestyle changes. And so part of the experiential part for the exercise is to actually take people out and say, this is what a moderate level of intensity of walking would be. This is more vigorous, and these are the types of shoes that you should be wearing to be able to go 30 minutes, 40 minutes. And we talk about hydration and other aspects as well.
Do you find that once you start people off on the correct way to do things, they're more likely to stick with it if they see success?
One of the key things about behavioral-based weight loss interventions is that if individuals find that they are successful, at least initially, and are starting to lose weight, those are the individuals who do better and really stick with the program. I think that one thing that would be interesting to me from a research perspective is when we have this up and going and having more boot camps to really look at the behavior, the change that is the result of the boot camps.
And so earlier in the year, the boot camp was featured at the annual Stowe Weekend of Hope. Tell us a little bit about that event, Curtis.
Well, that was a great event. I mean, that was our first go at this, and it was a lot to kind of pull together. I mean, you're having 3 different people, put some stuff, but we did it in a really practical way. We booked the right space for a very small group, and we put everything in a binder, so there were some really instant takeaways for people. They had recipes, they had kitchen sheets. They had the presentations by Dr. Dittis and Dr. Harvey, and it was there for them. And so they could come back and engage it. So they could be in the moment, they could experience it, but then they had the resources thereafter to follow up on. But it was great. I mean, we had a morning session with healthy cooking. Then they went off and they did some weight management presentation, and they went out and they exercised. And Stowe is fantastic for that, because they've got these great paths, and I mean, it was just really perfect for it. But it was a lot of fun, and it was that small, intimate setting where you could make a change, and I think everybody really appreciated what that day was about, and it was about them, and there were multiple cancers. It wasn't just breast cancer, which was really interesting, because I work primarily with breast cancer patients, and so it's interesting to see how diet influences the other cancers, and just how people want to embrace a lifestyle change.
And so this is a very popular event.
It was, and so we had room for 8 people. That was the desire to start out with.
Yeah.
We settled at 10, but 84 people had signed up that first day.
Wow.
And so a lot of people got disappointed, which kind of put the seed in the garden, if you will, for another boot camp and possibly more down the road. But yeah, it was really well received, and I think it was something that really spoke to people that, wow, I want to go experience this, and I want to make a change, for the better.
Does that surprise you that people really are interested in being well, being healthy, and living the rest of their lives in a changed kind of way?
I think that sometimes a cancer diagnosis and after completing treatment, it's a teachable moment. So people realize that they have an opportunity now to make some lifestyle changes that might help prevent cancer from coming back, but also prevent other chronic lifestyle issues such as cardiovascular disease, which is a very important, has very important lifestyle components. So I guess I wasn't surprised.
So the boot camp was so much in demand at the Stowe Weekend of Hope that now you're offering another one in October. What do you have planned, Kim?
So the one in October will be paired with the breast cancer conference. So the breast cancer conference is on Friday, October 10th, but then boot camp will be expanded and it will be over that weekend. So pretty much a full day on Saturday and then a partial day on Sunday, October 12th.
And the conference has been going on for a while. It's free to anybody who's interested to stop by and hear a variety of speakers or learn a variety of different things about the cancers. But now, then, after that, is going to be the new boot camp.
That's right. And it'll be held very close by to where the conference is held. It will be at the University of Vermont campus. And individuals then will be able to stay for the weekend, and we'll expand the food options provided. We'll expand the exercise components and the weight management components as well.
And Curtis, from your perspective, what can people expect?
Well, I think for us, it's really targeting the breast cancer population, which is that fits more of my niche in that. But I think it's great in the sense that by having it go longer, we're able to move groups in differently. So you're not all with the same pod of people. And we're trying to get 36 people into this one boot camp. And the way we have it scheduled is the way that a culinary school would schedule their kitchen use. So one group cooks for another that's out exercising, and for another group that's getting weight loss, management exposure and things from Dr. Harvey, and then that flips. And the one thing that I always say about a kitchen is if you share the table, it's that much better. So we're going to have 36 people plus ourselves and our support system sharing a meal together, 3 or 4 meals actually. So a day and a half, it is like a retreat, and it is more like a camp and not just a day seminar. So I'm really looking forward to that aspect of things.
Right, it will be jam-packed with information and hands-on activities.
So how can our viewers learn more about the Ultimate Survivor Boot Camp?
They can go on to the website associated with the breast cancer conference, and there's a link there, and I think you have a link also.
Yeah, we'll have a link on Pink Ribbon Cooking. And then our page will be up very shortly, ultimatesurvivorbootcamp.com.
And there's still room for people to register?
Certainly. Yep.
And so tell me a little bit, too, about if people are interested in the kinds of food that you're going to be talking about, Curtis. What are some of the recipes that maybe they'll be working on?
I haven't honed in on those, but they're going to be more savory. We certainly will have some salads. I really want to get into the realm of soup because soup is something that you can on budget friendly, and that is one aspect that I am going to focus on, is something that allows the family to partake in fresh local food. And so anything that we can do from a technique point that lengthens the serving portions, that maximizes the flavor of something you might get in a CSA box or something you might find at the farmer's market, and something that's in season, because when it's in season, it's affordable.
And so tell me a little bit, too, about some of the philosophy behind some of the foods that you prepare. I know that it's important to you to make these things not only fresh and delicious, but also easy.
Everything we do is easy. I mean, I have to, and it's hard because as a chef, there's a lot of things that I'm not allowed to do in these recipes. I'm not allowed to do the popular sous vide things because not everybody has a sous vide machine.
I don't even know what that is. But
so I focus on things that somebody can do in their home, that maybe a teenager could do, a caregiver could do, because again, in the breast cancer population, there's often a large role reversal that takes place, and that can be very stressful. We focus on things that are available in the supermarkets that are common in a farmer's market, so you're not out buying these exotic ingredients and paying shipping charges
that you might only use once.
Right, but we focus on flavor, and I think flavor and how food looks on a plate, so it's the invitation to eat healthier. And that was a quote from one of our members that said, "I love your recipes, but your photos are what really drives us to make the dishes."
That's again the Ultimate Survivor Boot Camp, Saturday and Sunday, October 11th and 12th. And for more information, you can visit vermontcancer.org. Thank you so much for joining us today.
Thank you.
That's our program for today. I'm Judy Simpson. We'll see you again next time on Across the Fence.